Wound debridement is a medical procedure used to remove non-viable, dead, or infected tissue from a wound. This process is essential for promoting wound healing, preventing infection, and creating an environment conducive to tissue regeneration. There are several methods of wound debridement, each with its own techniques and considerations. Here's an overview of the common methods. Sharp debridement. Sharp debridement involves the use of surgical instruments, such as scalpels, scissors, or forceps, to manually remove necrotic tissue, debris, and foreign material from the wound. This method is usually performed by trained healthcare professionals, such as doctors or nurses, in a sterile environment. The steps involved in sharp debridement include cleaning the wound and surrounding skin with antiseptic solutions, administering appropriate anesthesia to numb the area, especially if the patient might experience pain during the procedure, gently using surgical instruments to cut away necrotic tissue, slough, and any debris. The goal is to leave healthy tissue intact. Ensuring proper hemostasis, controlling bleeding, during and after the procedure. Applying sterile dressings or wound covers after the debridement is complete. Mechanical debridement. Mechanical debridement involves the use of external forces to remove necrotic tissue and debris from the wound. Some common mechanical debridement methods include wet-to-dry dressings. Wounds are dressed with moist gauze, which, when removed later, pulls away dead tissue. However, this method is less precise and can cause damage to healthy tissue. Hydrotherapy. Whirlpool or pulse lavage wounds are irrigated with sterile saline solution using specialized equipment. The force of the water helps to dislodge debris and necrotic tissue. Autolytic debridement. Autolytic debridement leverages the body's natural processes to break down dead tissue. This method involves using moisture-retaining dressings or hydrogels to create a moist environment that encourages the body's enzymes to gradually digest necrotic tissue. This method is particularly suitable for wounds with minimal to moderate amounts of necrotic tissue and low infection risk. Enzymatic debridement. Enzymatic debridement involves applying topical enzymatic agents to the wound to facilitate the breakdown of necrotic tissue. These agents selectively target non-viable tissue while preserving healthy tissue. Examples of enzymatic agents include collagenase or papainuria preparations. Biological debridement. Maggot therapy is a type of biological debridement where medical-grade maggots are placed on the wound. The maggots consume necrotic tissue and secrete enzymes that break it down. This method is typically reserved for cases where other methods have failed. Larval therapy, maggot debridement therapy. In this method, sterile medical maggots are introduced onto the wound bed, where they consume necrotic tissue while leaving healthy tissue untouched. The therapy is often used for chronic wounds with significant necrotic tissue. It's important to note that the choice of debridement method depends on various factors, including the wound type, size, location, patient's overall health, and presence of infection. The procedure should be performed by a trained healthcare professional in a sterile environment to minimize the risk of complications. After debridement, appropriate wound dressings, antibiotics, if infection is present, and ongoing wound care are crucial to support the healing process. Always consult a medical professional for proper assessment and recommendations tailored to the specific wound characteristics.